Hello, I'm Megan. I'm going to be doing a basic IV insertion. First, I would walk in and introduce myself to the patient. Hello, I'm Megan. I'm going to be your nurse today. Can you just verify your name and date of birth, Mrs. Smith? Okay, Sue Smith, date of birth, 3/12/43. All right, I've verified both verbally and on her wristband. Do you have any allergies, Mrs. Smith? Okay, she has no known allergies. Okay, Mrs. Smith, we're going to be doing IV fluids. The physician's ordered for you today for IV fluid replacement. Did you have any questions about that? Okay, no questions. Very good. All right, first thing I want to do is I'm going to come in. I'm going to wash my hands after I've introduced myself. My hands nice and clean. I'm going to prepare 3 milliliters of saline solution. Sterilize the top there. Drop 3 milliliters of air first. Inserting the air. Do a sweep, cap back on. I'm going to take the needle off and dispose in the sharps container. And I'm going to set this aside. I'm actually going to go ahead and get the INT ready. So I'm going to get my INT extension. It's sterile. I'm going to open it up. Make sure I don't touch the tip of it. So I don't have gloves on yet. Go ahead and hook that up. And set it off to the side here, ready to go. With the clamp off. Okay. Next I'm going to check the radial pulse. Make sure we have a good strong pulse. Alright, we have a pulse. I need to determine where I'm going to insert the IV. So I'm going to be checking for something that's not going to be painful. So I'm going to palpate, make sure I don't have a painful site. I want something that's going to be distal on the arm with no other IV sites nearby. I'm going to have the patient make a fist, pump their arm. Again, I'll make sure that the vein is bouncy and there's no pain. Once I've chosen the site, I'm going to do the tourniquet about 4 to 6 inches from the chosen site. And I'm going to prep it with an alcohol. Circular motion, inside to the outside. Make sure it's air dry. And then I'm going to apply my gloves. Okay, my chosen site. I want to pull back, stabilizing, making sure that my hand is out of the way. Getting the 20 gauge. This is a 20 gauge catheter. I want the bevel side up, and we're going to be going in at a 15-degree angle. I would warn the patient there's going to be a little stick, but I would do it quickly. Maybe observing for flashback, which I have. As soon as I see some flashback, I'm going to apply pressure. While I disengage this bit. going into the sharps container. Next, I'm going to be releasing the tourniquet, still keeping pressure, and attaching the IV flush. I'm going to observe for some flashback, which I have. And then I'm going to give a little flush, keeping positive pressure. And then clamping it. Once it's clamped, I'm going to detach the saline flush. Next, I need to put a tegaderm over the IV insertion site. Making sure to not cover it with the initials so that you can still see the site. Once that is placed in a good place that can be read, I'm going to put the date, the initials, today's date, the time, and the initials. And put another piece of tape to secure the IV line. Which is easier said than done. Alright, once I'm done with that, I'm going to make sure all the sharps are in the sharps container. Everything is cleaned up, making sure that there's no tenderness, no immediate swelling, making sure the patient is comfortable. I'm checking the 4 Ps, checking their position, their pain level, making sure that they have all their personal belongings, and making sure they don't need to go to the restroom. And lastly, I would need to document the time and date and my initials, where the IV was started, which would be the right forum in this case, the size and type of catheter, which was a 20 gauge, the number of attempts, which I got it on the first attempt, and the client's response to this procedure. And that is it. Thank you.